Hi everybody, I'm Simon Reith, I'm CEO of Thorne Harbour Health. I'm coming to you tonight from Boonwurrung land, and I'd like to start by paying my respects to the traditional custodians of the lands on which Thorne Harbour Health works in Victoria and South Australia, and also the lands on which our respective panellists are on tonight. The format for the evening will be 2 presentations followed by a panel discussion. The event is being recorded and is in webinar format, so only speakers are visible, but if you post in the chat, your comments will be visible. You can use the chat feature to ask questions throughout the event, and towards the end of the event, we will do our best to get through as many questions as we can. I want to thank our panellists for taking the time out to be with us tonight, and I'd also like to acknowledge that COVID-19 has placed additional pressures on sex workers and sex work organisations, particularly here in Melbourne, where we have remained in extended lockdown. The topic for tonight is sex work decriminalisation. Victoria has a review underway currently and to make recommendations into decriminalisation of sex work. So we're fortunate to have the leading peer voices from around the country with us, so that we can learn what has and hasn't worked in other jurisdictions. Conversations about sex work often occur without the voice of sex workers, and because of this, those conversations are often driven by misinformation, misunderstanding and fear. It's important that organisations such as ours create opportunities for sex workers' voices to be heard. So for the rest of this session, you will be hearing from sex workers themselves. I'll now hand over to our moderator for the evening, Jules Kim. Jules is the CEO of Scarlet Alliance, the Australian Sex Workers Association. She is well known for her advocacy both within Australia and our region and also across the world. And she will also be giving our first presentation, and Jules will introduce the other panellists. Over to you, Jules.
Thanks very much, Simon. I really want to take this opportunity to thank Thorne Harbour for organising this event and for all our wonderful panellists for joining us, and for all you wonderful participants for coming and joining us on this panel. I'd like to acknowledge that I am on Gadigal land and pay my respects to elders past, present and leaders emerging. Acknowledge that sovereignty was never ceded. I'm going to just share my presentation now, just to give you a opportunity to just get a perspective on what decriminalisation is and what it isn't and what it does, and the models of legislation that we have broadly around Australia. So for those of you who aren't familiar, Scarlet Alliance is the Australian Sex Workers Association, and we were formed in 1989, and we are the national peak body that represents our membership of individual sex workers and sex worker organisations throughout Australia. Through our objectives, Scarlet Alliance aims to achieve equality, social, legal, political, cultural and economic justice for past and present sex workers, in order for sex workers to be self-determining agents. So the laws for sex work in Australia are incredibly complex. There are different laws in each state and territory, and there are different laws for different types of sex work. So we have different laws for private sex workers versus brothel-based sex workers versus street-based sex workers. For all the different types of sex work, there's different forms of legislation. And there are also laws that govern sex work, bloodborne viruses and STIs. Often there can be contradictory laws between federal and state-based laws. So on one hand, we might have certain states where sex work is still largely criminalised, but according to federal laws, like for example, taxation, we are considered lawful and therefore required to pay taxation even though we're not recognised under the law. And unfortunately, there are no consistent anti-discrimination protections for sex workers. So what this means is that we actually currently have a really piecemeal framework around anti-discrimination legislation, currently in 4 states, and that only kind of covers a really small portion of sex workers. For example, in Queensland and Victoria, we have protections for lawful sexual activity, but for sex workers that aren't working within a very small licensed framework, aren't able to access those protections. Additionally, in ACT, sex workers have protections under occupation, trade or calling. But again, there are limitations given depending on the standing of sex work and the recognition of sex workers' work. It is important that sex workers have anti-discrimination, anti-vilification protections as an attribute for sex work and sex workers and associates of sex workers. So in each state, as I said, each state and territory administers their own sex work legislation, and broadly these fall into one of three legal frameworks: criminalisation, licensing and decriminalisation. In Australia, all jurisdictions actually employ somewhat of a mixed combination. Until recently, we had Northern Territory that did fully decriminalise sex work, and Leanne will speak to that a bit later on today. But for the other states, for all the other states, we have a mixed framework. But what is promising is over the past few years, we have seen law reform processes gaining momentum in each state and territory and progress towards decriminalisation, support for decriminalisation building, and a real sex worker-led movement towards the decriminalisation of sex work. So, problems of criminalisation, for example, in states like WA and South Australia, where sex work, for the most part, sex work workplaces and clients are criminalised, we often see the disproportionate targeting, harassment and displacement of sex workers. Often police use possession of condoms as evidence that a crime has taken place. For example, in WA, a sex worker does not have the right to remain silent and can be strip searched just because of the fact that we are sex workers, or if somebody is suspected to be a sex worker. In some states, unfortunately, it is still unlawful to be a sex worker living with HIV, such as in Queensland and Victoria. And this is regardless of whether you provide protected services, whether you're catering to just HIV positive clients or have undetectable viral load, or whether any transmission has taken place. It's just by the act of being a sex worker that's exchanged money for sex, that in itself is unlawful. Unfortunately, criminalisation also extends to Australia's criminal justice approach to anti-trafficking, where we have seen racially based harassment and detention of sex workers, Asian sex workers, for the purposes of migration compliance. And what you see here on this slide is a picture from a supposedly trafficking investigation. And this happened in Surrey Hills, and the Australian Federal Police that are responsible for enforcing the trafficking laws had gone in. Often, there'll be groups of police officers and immigration officers, border force, that go into sex industry workplaces, and in this instance, they actually also took along media and sex workers who were supposedly, experiencing trafficking or having, been exploited, are supposed to feel comfortable to be able to speak to these police officers about the issues they might be having in their workplaces. Now, trafficking is not a widespread phenomenon in the Australian sex industry. This has been borne out in numerous research projects. But that's not to say exploitation doesn't happen in the sex industry. We are an occupation, like all occupations. We have good workplaces and bad workplaces. What is problematic is when anti-trafficking legislation is used as a form of visa compliance and sex industry compliance, and is not actually doing anything to support the rights of sex workers, whether they be migrant or not, that are experiencing workplace exploitation. Similarly, licensing is often misleadingly referred to as legalisation, but we would more accurately describe it as over-regulation. And this is why we refer to it as a licensing framework, like is in place in Victoria and Queensland. Licensing may ban sex workers from working in residential areas, requiring sex workers to work in isolated industrial areas, and posing a threat to sex workers' safety. It can prevent sex workers from working together, reducing our access to safety, support, and peer education. Licensing may require us to disclose our legal names to clients or the public, increasing the risk of harassment. And it also may require us to register our legal name and addresses on a permanent police or government record. Now, these records can never be removed. Even after the sex worker dies, that record is there permanently forever. And it doesn't provide any protection or support for sex workers, but instead has been used in other ways that has really significantly disadvantaged sex workers, and is essentially like a brand for life that creates issues for sex workers if they want to leave the sex industry, has created issues for sex workers in custody cases or unrelated criminal cases, and has been an issue in a range of contexts. Licensing inevitably creates a two-tiered industry because in a lot of cases, sex workers are unable to meet the onerous requirements of licensing and are forced to work illegally in order to protect our health, safety, rights, and privacy. There's a long history of police regulation, corruption, and entrapment practices that means that sex workers in a licensing model are less likely to seek police assistance in the event of a crime. Sex workers' human rights are intrinsically linked to sex workers' ability to negotiate with clients, to access essential services and satisfactory workplace conditions. Criminalisation and licensing routinely violate sex workers' basic human, civil and industrial rights. Basic human rights that are taken for granted are often inaccessible for sex workers. In some jurisdictions, sex workers do not enjoy the right to freedom of movement. We face restrictions on travel and restrictions on our mobility across various sectors of the industry and out of the industry, and pressure to relocate to areas that pose danger to our safety. Some sex workers are denied a freedom of association, with laws in some states forbidding sex workers from working with drivers, security, or colleagues, limiting our ability to organise, advocate, and work safely. Sex workers are denied the right to free choice of employment and just and favourable conditions of work, facing the criminalisation of our workplaces, our work colleagues, barriers to occupational health and safety at work, and limited access to legal remedies due to stigma and prejudice. Sex workers are often discriminated against on the basis of our HIV status. HIV positive sex workers in Australia have been criminalised and jailed, even when no transmission or unsafe practices were proven. Sex workers often face additional stigma related to drug use, HIV status, ethnic migration status, or sex and gender identity. Often sex workers living with HIV face dual stigma for being a sex worker and being HIV positive. In many cases, we are rejected by family, face abuse, criminalisation by governments, and are left behind when it comes to treatment and care. For migrant sex workers, HIV status can be grounds for deportation. And sex workers can face a range of issues that transcend the culture or the legal status of sex work. Law enforcement and other positions in power act in ways that can be incredibly negative for sex workers. Written laws and policies do not always reflect the actions of law enforcement and health officials. For example, in some states, the possession of condoms or money is assumed by police to be proof of sex work and is enough grounds for charges. Sex workers are regularly targeted for arrest and prosecution, resulting in barriers to accessing healthcare, services, and support, treatment, and justice. The UN Political Declaration on HIV/AIDS recognised a key element of HIV prevention was in recognising HIV prevention, treatment and care, was in recognising the crucial role of human and legal rights in preventing and eliminating HIV. Countries around the world, including Australia, committed to the rights of all people to the enjoyment of the highest attainable standard of health, including sexual and reproductive health and rights, HIV prevention and access to treatment. And human rights applied to all people, including female, male, trans and gender diverse sex workers, migrant sex workers and sex workers living with HIV. In reality, sex workers often face high levels of harassment by police and government, and have limited or no access to rights and legal redress, and aren't protected by law. Stigma, discrimination, human rights abuses and criminalisation of our work are challenges that sex workers face daily. And these have also been recognised as the greatest barrier to controlling HIV, other bloodborne viruses and STIs. Now, decriminalisation is essential to improving the health, safety and human rights of sex workers. Evidence from places where sex work is decriminalised or partially decriminalised, such as New Zealand, New South Wales and Northern Territory, reveals that labour rights of sex workers increase access to HIV sexual health services and actually encourages testing and condom use. Decriminalisation has resulted in low STI rates and low or non-existent HIV transmission in sex work. In contrast, in countries where sex work is criminalised or otherwise legally oppressed, higher numbers of sex workers are currently living with bloodborne viruses or STIs. A number of studies have found laws against sex workers and sex work increase vulnerabilities to HIV by increasing stigma and discrimination, limited access to health services and to condoms, and generally having a negative impact on sex workers' self-determination and ability to organise and make informed choices. Removing criminal laws is essential, but it's not enough to prevent sex workers from being arrested, abused, harassed and mistreated by police and the justice system. Sex workers are affected by many different laws and policies that are aimed at preventing or regulating sex work that may include criminal or punitive laws that make all or some parts of sex work illegal, such as criminalisation of clients and anti-trafficking laws, regulations, civil and administrative regulations, local council regulations, local ordinances and policies such as loitering, public offences, indecency, and sometimes public health laws, such as the detention of sex workers living with HIV or other STIs. In the report, Sex Work and the Law in the Asia Pacific, the UNAIDS, UNDP and UNFPA found that positive public health and human rights outcomes have been achieved in jurisdictions that have decriminalised sex work. So what is decriminalisation? Decriminalisation, a framework, repeals criminal laws that are specific to the sex industry, and it regulates sex industry businesses through standard business planning and industrial codes, and doesn't single out sex work for specific criminal legislation, and removes police as the regulators of the sex industry. Sex industry businesses are treated like other businesses, subject to the existing regulatory mechanisms and also to workplace protections for sex workers. And these regulatory mechanisms can include local council planning, zoning and location controls, workers' compensation requirements, occupation health and safety standards, and industrial rights. And police are not involved as regulators at any level unless there's a breach of law. Now, decriminalisation reduces corruption and increases transparency. In a decriminalised framework, corruption is reduced because police aren't involved as regulators unless there's a breach of law. One of the major drivers for decriminalisation in New South Wales was the findings of the Wood Royal Commission into the corruption within the New South Wales Police Force. The Commission cited evidence showing that there was a clear nexus between police corruption and the operation of brothels. In a decriminalised environment, sex workers are more likely to approach police in the event of a crime because they're not fearing being arrested or charged just because they are a sex worker. Decriminalisation means better access to outreach, education, health promotion, and it's a huge array of research that clearly illustrates that decriminalisation is the most effective model in the prevention of HIVs and STIs, and this is supported within Australia's national HIV and STI strategies and hepatitis strategies. In the comparative study in 2005 of brothels in Perth, Melbourne and Sydney, Harcourt et al. Found that the three Australian approaches to sex work legislation, criminalisation, licensing and decriminalisation, that decriminalisation led to the best health outcomes and better access to health promotion. Decriminalisation also supports workplace health and safety. Without the threat of criminal sanctions, sex industry businesses within a decriminalised framework has a greater capacity to develop comprehensive workplace health and safety policies, and workers are better able to assert our workplace health and safety rights. A decriminalised environment gives businesses further opportunities to develop important workplace health and safety policies in consultation with their workers, including ensuring that there's sufficient safer sex supplies, and developing policies to prevent and deal with any condom breakages or violence in the workplace, providing training and education on the safe use of equipment, and recommending culturally appropriate medical health services. The New South Wales Government report on the brothel task force found that decriminalisation had a positive impact on workers' access to occupational health and safety and health services, and that arguments for a separate licensing authority should be rejected, as this is an area for potential corruption and would actually increase the numbers of sex workers working illegally. And decriminalisation doesn't increase the size of the industry. Research evaluating the impact of decriminalisation in New Zealand provided strong evidence that decriminalisation did not lead to an increase in the size of the sex industry. The New Zealand Prostitution Reform Committee found that the numbers of sex work in Christchurch had stayed approximately the same despite the decriminalisation of sex work. In New South Wales, the Lash report showed that the number of sex workers in Sydney brothels 20 years after decriminalisation was similar to the estimates prior to decriminalisation. Decriminalisation doesn't mean no regulation. In fact, when sex work is criminalised, that subjects sex work to a lot less regulation. It is actually a whole of government regulation. It doesn't put sex workers outside of the law. There's this perception that all of a sudden that sex workers will not be subject to the same laws as everybody else, but that is not the case. It just means that sex workers are subject to the same laws, but able to access protection from those regulations and legislations as everybody else. Criminal laws still apply to sex work and sex workers, just as they do to everybody else. But it doesn't create new laws for sex workers, and it doesn't leave sex workers behind. And there is a lot of evidence. It's widely recognised that decriminalisation is the optimal model for sex work legislation. A decriminalised framework removes police as regulators of the sex industry. It repeals criminal laws specific to the sex industry, regulates sex industry businesses through standard business, planning, industrial codes, and doesn't single out sex workers for specific legislation. In doing so, the decriminalised system removes barriers to HIV prevention, amplifies opportunities for health promotion, and magnifies capacities for peer education. It improves occupational health and safety and access to human, civil, and industrial rights. Favourable experiences of decriminalisation demonstrate that decriminalisation supports sex worker self-determination, maximises compliance, increases transparency, reduces police corruption, and minimises discrimination. And there's ample support for sex work, of decriminalisation of sex work. It's growing every day. Amnesty International support it from a human rights perspective. The International Labour Office, the ILO, supports that decriminalisation and recognition of sex workers' work to support decent work conditions. The World Health Organization supports decriminalisation as a technical recommendation. Now, this is to say that it is essential to public health. The Lancet Journal stated that it would have the greatest impact on the course of HIV. It was a single intervention that would have the greatest impact on HIV over the course of next 10 years, resulting in 33 to 46% reduction in transmission. The Global Alliance Against Trafficking in Women stated that decriminalisation supports positive conditions and opportunities for redress for all workers, including those experiencing trafficking and exploitation. UNAIDS, UNFPA, UNDP found that decriminalisation was necessary for health, safety, and sex workers should be setting national priorities and agendas. Our own national bloodborne virus and STI strategies state that decriminalisation is essential to health promotion, reducing barriers to testing, prevention services and care. Now, I'm going to end with a quote by the Honourable Justice Michael Kirby, who stated that repealing criminal laws against sex workers is a matter of true public morality. Supporting is continuing to grow for the evidence-affirmed best practice model of sex work regulation, which is decriminalisation, in case you didn't guess from my presentation. So thanks very much for listening to why we all need decriminalisation. And now we're going to move to Dylan, and Dylan O'Hara is the spokesperson for Vixen, and they will be presenting on the impacts of the legislative framework in Victoria. Dylan, over to you.
Thanks, Jules. Okay, great. Cool, thanks so much for the introduction, Jules. So yeah, as Jules said, my name is Dylan O'Hara, they and them pronouns please, and I'm here representing Vixen Collective, the Victorian peer-only sex worker organisation. So just a little bit about Vixen Collective for anyone unfamiliar. So we are the Victorian member of Scarlet Alliance, and in all our work, we promote the cultural, legal, human, workplace, occupational, civil rights of all sex workers in Victoria. And Vixen Collective always has been and still is an unfunded organisation, which means that it's run entirely on the labours and energy and donated time of Victorian sex workers, past and present. And Vixen Collective is entirely by and for sex workers. And so that means that there is nobody who is a boss, there is nobody who is an operator in the industry, there are no third parties or other people involved in other kinds of work in the sex industry, no partners, no allies, it's just sex workers. And actually, before I do that, I'll just say as well that it's really exciting to be presenting at this event. This is a really exciting and scary year, obviously for everybody in the world, but specifically for Victorian sex workers in relation to sex work laws in Victoria, because this is a time of great opportunity for us. I think in order to understand why decriminalisation is so crucial in Victoria at this time, it's important that we all have a clear understanding of what the current laws are, and why they don't work, and why they're so harmful to Victorian sex workers. So I'm going to give a little summary of how the laws currently work and what they involve. I'm also going to then go into a little bit more detail about some of those elements and some of the impacts. I'm also going to have throughout a few quotes from sex workers who consulted with Vixen and consented to have those quotes included here. And part of the reason for that is that as sex workers in Victoria, we're the most, we are the primary stakeholders in this process. Our voices are the most important ones, and sex workers are more than capable of speaking for ourselves, as demonstrated by this the wonderful lineup on the panel tonight. So just wanted to highlight some of those voices. So the Victorian licensing system is a really complex bureaucratic system, lots of red tape. It consists of laws that are across several pieces of legislation, Sex Work Act, Sex Work Regulations, Public Health and Wellbeing Act as well. And the way that the Victorian licensing system works is that it produces a two-tiered sex industry. You have a compliant, sometimes people call that a legal part of the industry, and you have a non-compliant, or as some people refer to it, sometimes illegal part of the industry. And that's because the requirements, it's a very damned if you do, damned if you don't situation for Victorian sex workers to work compliantly within the regulations. You have to adhere to really unworkable and extremely complex laws that violate your privacy, your human and occupational rights, and make it really difficult to practice, to work in the way that you want to, that works best for you and is safest for you as a worker. So that means that we have these two parts of the industry in Victoria, and another major feature, of course, then is that police function as one of the primary regulators or enforcers of those laws. So I'll go into more detail about some of this in a moment. And I did time this out, but if somebody wants to wave at me, I can see all your faces. If I'm going over time, please do, Jules or somebody. So, because everyone here who's met me knows that I can, not always that concise. So, under the Victorian licensing system, so street-based sex work is entirely criminalised. Private sex work or sole provider sex workers, independent sex workers, escorts, some of the other phrases that people use, are required to register with the BLA. And that's basically a permanent record, because you can't ever have you can't actually have your details removed. So that's your legally identifying details for life, alongside sex worker status, regardless of whether that registration is active or not. There are also major limitations on how you can work. So technically speaking, it's possible in Victoria to be a private worker and go through the process to be able to essentially operate a brothel of one in your own home, but it's so difficult to do that it's functionally impossible. So what that means is that most people are, if they're working compliantly, only able to offer outcalls, so they're going to less familiar environments. Whoops, what have I done? It's not what I wanted to do. There we go, sorry. There are really exacting licensing and zoning requirements for brothels to be licensed, to be compliant. And for sex workers, what that means is that we have much more limited workplace choices, among other things. And there are impacts for workers who are working in licensed brothels, as well as for workers in unlicensed brothels, which again, I'll talk more about in a little while. There are also very strict advertising regulations, which are discriminatory and make it really difficult for sex workers to not just to do their work or conduct their business, but to to practice screening and safety strategies and harm reduction in the ways that we would prefer to or choose to. Health and safety is mandated by law, particularly around issues around mandatory testing and the criminalisation of sex workers living with HIV, which we'll talk a little bit more about some of that soon, and I know that some of that's going to be talked about on the panel as well. So I think when thinking about the licensing system and understanding it, it's important that we be clear on what it's about, and that these impacts that I'm going to talk about are not, they're not coincidental, they're not by accident. The licensing system is designed to control sex workers. It's designed to control sex workers and the existence of sex work, and to surveil and monitor us, to regulate our bodies, our work choices, other parts of our lives. That's its function. It doesn't support sex workers in any way at all, and in fact it actively harms sex workers in a number of different and often intersecting and compounding ways, not just at work, but throughout all parts of our lives often, or many parts of our lives. And in and of itself, it is a discriminatory system. It's also a system that then produces more discrimination, and it generates more stigma. It also doesn't work. It doesn't work on its own terms. It doesn't do what it claims to do. Licensing is an approach that is not based on evidence and is fundamentally out of step with other approaches to public health, to workers' rights, and in other areas that are relevant to the lives of all people who work, not just sex workers. So some of the key impacts on sex workers include a reduced choice over how and where we work, with who we work, when we work. It, as I said, fundamentally undermines our ability to implement, our chosen safety strategies and harm reduction strategies. Again, this is a way in which the current laws make people actively unsafer and actively less safe. There we go. It also brings sex workers into increased contact with police and with the courts, particularly sex workers who are already subject to increased police targeting based on, other kinds of marginalizations. So particularly, sex workers of colour, transgender sex workers. It impacts sex workers who are street-based sex workers particularly. It also produces barriers to justice. So for sex workers who may choose to access the police to report a crime, whether it's to do with sex work or not, the current system creates barriers to that. both for workers who are working non-compliantly and so have that barrier in terms of no guarantee at this time from Victoria Police that they won't be charged or fined, but also for workers working compliantly, there is a very real fear of experiencing stigma and discrimination from Victoria Police, and that as well is a direct product of the licensing system, because the licensing system reinforces and reproduces so much of the stigma that Victorian sex workers currently experience. The system fundamentally violates our privacy, and yeah, as I've said and we'll speak about more, produces other forms of discrimination as well. So, as I already mentioned, there are a number of impacts on sex workers who are doing private sex work. I think that one of the things that's really important about that, that I think about a lot myself, is the fact that the system forces sex workers to choose at the moment between working compliantly and therefore only being able to go to where their clients are, which can impact our safety. It also can make it harder to make money, which is, you know, of course, like anybody doing a job, why sex workers are doing their job. It fundamentally undermines our autonomy at work when we're not able to choose what environment we work in. The other choice is to work non-compliantly and then have the option of working from your own space with other workers. And while some workers may choose to work by themselves, we know that many sex workers, if given the opportunity, will choose to work in their own spaces with other sex workers, perhaps hiring support staff as well, without a management structure, for the same reasons that lots of other workers like to work with other people, for camaraderie, to share costs, and also to promote our safety at work. And as mentioned, the requirement to register currently on what's called the exempt register, that fundamentally violates sex worker privacy, and it can lead to really major implications in other parts of people's lives, because although the register is not public, it is accessible by police and other authorised bodies, and it can have implications for people in many parts of their lives, including things like potentially custody, immigration status, things like that. So, aware of the time. So, for workers working in venues, brothel-based sex workers, or also workers in other managed workers for escort agencies, the licensing system means that to work in a licensed brothel, you're choosing between a limited range of options, and you're likely to be working somewhere that, due to zoning requirements, may be in an isolated area, maybe in a remote area. It may have poor lighting, and obviously if you're working at night and you're travelling to and from work, in an isolated place in the middle of the night, that obviously has safety implications for workers. The licensing system also gives us disproportionate power to operators and managers of brothels. It's really difficult for workers in Victoria at the moment to effectively organise in their workplaces, to have bargaining power, to respond to issues in their workplace that are important to them, which might be issues around safety and clients, but they might be issues that are more mundane, that people, I think, don't always expect that sex workers will talk about. But things like, just thinking of every brothel I've worked at where a shower head has literally fallen off and hit me on the head while I've been showering, for example. These kinds of basic maintenance issues, things like that. Shift allocation, any of these kinds of issues that are common in lots of workplaces. It's very difficult to advocate for your rights and desired work conditions when there's this really limited range of workplaces. And if you may find yourself running out of workplaces quite easily if you if you get a reputation as somebody who is, you know, I guess organising in your workplace. I think as well for workers in non-compliant brothels, there are a lot of issues, and one of them in particular that we hear about a lot as well is about occupational health and safety. This is a quote from a Victorian sex worker. So I'm just going to read it out. Licensed places can't advertise for workers. So the only ads I saw were for unlicensed venues. When I first started with them, we worked from an apartment. The building manager cottoned on to us and we were evicted. So then we moved to another place above a shop. There weren't any showers or anything there. The bosses didn't want to invest in setting up a proper shower or anything for us in case we got caught again. You know, and so in this way, the licensing system actually actively disincentivizes, you know, actively disincentivizes operators and managers of venues from upholding occupational health and safety standards, either for fear of detection, because it seems not worthwhile, and again, it makes it very difficult for workers to have any bargaining power or to actually organise effectively in those workplaces. So for street-based sex workers. So street-based sex workers in Victoria, as I mentioned, street-based sex work is criminalised in Victoria. And although street-based sex workers make up actually a very small proportion of, you know, of the sex industry in Victoria, nonetheless, these are workers who are, you know, disproportionately vilified, stigmatised, you know, made visible and targeted by police. So criminalisation of street-based sex work forces those workers to operate more covertly, has a really big impact on their ability to implement their safety strategies, their client screening strategies. It makes clients nervous. It makes it difficult to, therefore, to take the time to negotiate services or to assess safety. It also can create this cycle of being penalised for working, therefore, of course, meaning that you need to work more to pay the penalty and so on and so forth. And as mentioned, the role of police in the licensing system and the licensing system itself forces many sex workers into direct contact they would not otherwise have with police and the courts. And that's especially really particularly true for street-based sex workers who really bear the brunt or a large part of the brunt of that in Victoria currently. And, you know, there are many impacts of that. Obviously ending up with a criminal record related to sex work or criminal record in general can have implications that can run throughout somebody's life, can limit their, you know, other work options, other lifestyle options, education, and all kinds of things. It also, the criminalisation of street-based work under the licensing system also produces really significant barriers to accessing services for street-based sex workers, including from, you know, the ability of peer services to effectively do outreach to those workers. Health for sex workers under the licensing system. I won't speak about this for too long because I'm going to speak to that, I believe, on the panel about mandatory testing. But one of the fundamental issues in this area for sex workers in Victoria is that the licensing system, it singles us out from the rest of the population as requiring, you know, legally mandated guidance around our health practices and our sexual health practices and testing. So it's discriminatory in that sense. The system requires what's usually referred to as mandatory testing, 3 monthly testing to get a certificate. So this is really intrusive, it's unnecessary. I'm going to speak more about the ways in which it's harmful on the panel, so I won't say more about it now, but I think it's just really important to note that, yeah, that mandatory testing is not based in evidence and really doesn't do anything useful. It also costs a lot of money for the state, the taxpayer. The current practices around health and sex workers under the licensing system are all grounded in I would argue, in a notion of sex workers as vectors of disease, as this kind of contaminating population that need to be kind of sectioned off from and managed in our healthcare practices, or our sexual health practices specifically, in order to protect the rest of the public, and also for our own good, as if we can't manage it ourselves, which is very much not the case. In this way, it's discriminatory, but it also actually actively produces the stigma. And, you know, I know that myself, I've had many, many conversations with other sex worker friends about the various ways in which, not just when we're doing work, but in other parts of our lives, that this kind of vectors of disease stigma that is produced and reinforced by things like mandatory testing, the way that it impacts us in all kinds of areas of our life where we will encounter these really damaging and sometimes extremely dangerous attitudes from the general public that are a direct result of that. It also produces barriers to other healthcare because those same stigmatizing attitudes are ones that are often held by other health professionals as well, even when we're not seeking healthcare directly related to sex work or sexual health. So this is a quote from a worker as well. This is an experience that I think a lot of sex workers in Victoria have had. It's something that we hear a lot from our community. It's the sort of sex worker equivalent of what trans people call trans broken arm. So, you know, you go to the doctor for a specific thing and suddenly the healthcare that you're given is about this one specific element of your life or your identity or your work in this case. And this produces huge barriers to sex workers in accessing healthcare that is in fact unrelated to their work, which is a really big problem. It should be possible for anybody to access the healthcare they need and not have to be concerned that they're going to be exposed to these kinds of attitudes. And I think that this is an example of the ways in which the licensing system and sex work stigma in general has these really kind of like tentacles of stigma and discrimination that go out into lots of people's lives and interact with each other. Thanks, Jules. So as I mentioned, licensing system forces sex workers into contact with police. I think one thing just to touch on is that this does produce really real barriers to reporting crimes or to accessing police assistance or to having acceptable experiences with police when encountering them for other reasons. It also flows into issues that happen with agencies adjacent to the police. So this is a sex worker talking about an experience, I probably should have taken up the organisation, that, you know, experience that they had at another service. And that's a story that we hear a lot as well. So that ties neatly into the final part of my presentation before I will finish, which is just to touch on discrimination and stigma. There's a lot that can be said about all of this. Something I just want to flag, because I think it's important, is that currently at the moment, in terms of formal mechanisms around discrimination, sex workers have really limited access to those in Victoria. Sex workers have limited protection under something called lawful sexual activity, but that doesn't apply to sex workers who are forced to work non-compliantly, and it has other limitations as well. And something that I think is important to flag is that there is an exemption in the Equal Opportunities Act that allows for accommodation providers to discriminate against people who are engaging in lawful commercial sexual activity. So that's this, really specific, ironically discriminatory exemption that applies only to sex workers. So that's all I have. I'll leave it there. Thank you very much, and I'm back to you, Jules.
Thanks so much, Dylan. We are extremely fortunate in having an incredibly illustrious panel of speakers tonight. And I'll just go through and introduce everyone. So if you want to wave when I introduce you, but I think your name's already up on the little Zoom screen, so that will give away who you are, and many of you might recognise you from your roles. So we have Leanne Melling, who is the coordinator of SWOP NT. with us today. We're extremely fortunate because, you know, as you know, NT was only the third jurisdiction in the world to achieve a form of decriminalisation, and that just happened late last year. And so we'll hear a bit about that from Leanne. We have Janelle Fawkes, who some of you might recognise as the prior CEO of the Scarlet Alliance, but she's also Respect Inc. and campaign leader of Decrim Queensland, which is the group of sex workers in Queensland who have joined with Respect Inc. to achieve the decriminalisation of sex work. We have Cameron Cox, who's the CEO of SWOP New South Wales, and Kat Morrison, who's the general manager from SIN, which is the Sex Industry Network in South Australia. I know we were having some connectivity problems, so hopefully, I know Kat's in the audience. Hopefully Kat will be able to join us on the panel once we get to the questions. So let me start. Also, I'll encourage the participants to share your questions too in the Q&A. We'll see that we've already gotten 2 great questions in there. If you've got other questions that you would like to ask, please put them in the Q&A. If we don't get to them in the panel questions, then we will address them in the chat box. So please send us your questions. Janelle, I'm going to start with you. Queensland also has a licensing model like Victoria. And in your opinion, is this a situation working for sex industry businesses and workers in Queensland? And what needs to change?
Well, thanks, Jules. Look, I think we can all agree that licensing is a failed approach or a failed concept. And, you know, it's really based on the idea that you can place a restrictive model onto the sex industry and expect that the sex industry is going to reshape to suit what's allowed by that model. And of course, it doesn't happen that way. It's the idea that you can take a one-size-fits-all approach and then expect everybody to jump through all those hoops and then move into what's allowed. Of course, the reality is very different, and the decades of our experiences in Queensland and Victoria demonstrate that licensing models just don't work. As Dylan outlined beautifully, what they do result in is leaving a large part of the sex industry outside of the framework and under police control. There's very little incentive to comply, and for many, no ability to be part of that licensed sector. And, you know, that includes business model types like massage parlours, etc., that just, there is no way for them to comply and be part of the legal or licensed sector. I think that for Queensland and Victoria, though, there's an extra element of that, and that is that the stated purpose of the legislation itself, when the licensing framework was introduced, is based on a flawed concept, and that is that, you know, the purpose is to control the sex industry, and that really leaves out what we need, which is the recognition that sex work is work. And the aim of any legislation should be to provide workplace health and safety rights for sex workers, and to the model should incorporate existing sex industry business models and sectors, and it should allow for all of those sectors and parts of the industry to be part of you know, what's allowed.
Thanks, Janelle. Leanne, in November last year, a bill that fully decriminalised sex work in the NT was passed. This is a huge achievement, and the Sex Industry Act, as it is now in force, also required amendments to the planning scheme. The changes to the schemes allows for sex workers to be able to sex work to be able to take place in both residential areas and for more than 2 workers in commercial business areas without specialised zoning. Can you explain what some of the challenges were and how sex workers led in providing evidence that contributed to planning and workplace health and safety reforms?
Sure. So just to introduce, sex workers through SWOP NT, the Sex Worker Reference Group, and through the Scarlet Alliance have continued to advance our leadership to ensure the intent of benefits of decriminalisation are understood by all Northern Territory stakeholders, including government agencies, that are involved in ensuring equitable inclusion of sex workers' work and sex work businesses into the decriminalised framework. This has included participation with consultations with the Planning Commissioner, other ministries involved in the regulatory process, to ensure as sex workers our needs and rights are well understood and are upheld without discrimination. By far, stigma and discrimination and the right to work in an equitable environment has been a major barrier to sex workers being able to be truly respected as leaders in our own agency of our work and in our respective representative roles in leading the reforms. At every stage where stigma and discrimination has put barriers up for us, we have knocked those barriers down, providing very practical solutions in the reform process with absolute integrity and, importantly, transparency. For example, we represented in both public and closed hearings for the passing of the providing evidence for the passing of the Sex Industry Bill in 2019 in November. It was passed, and then also more recently this year, at the beginning in January in 2020, hearings that supported the recent amendments to the NT planning scheme that was ratified in June. So very recent implementation of decriminalisation. We were invited to provide evidence to the NT Government's Legislative Assembly and Economic Scrutiny Committee. NT sex worker representatives, upon request, were granted safe spaces in closed sessions to the committee. Sex workers were able to then freely in-camera provide evidence that we directly related to systemic stigma and discrimination, the detrimental impacts of lifelong police registration for sex workers, previous licensing system, and the limiting of ability to work safely under licensing without being criminalised. Sex workers presented evidence in a safe environment to respond to the committee's questions without negative consequences, and that was a very positive outcome. The transcripts of all of our evidence through case studies documented, and over 7 different, very diverse sex workers from very different backgrounds and having various experiences that represented our communities, presented the documented case studies from our communities, and all of our information was only very lightly redacted, and that was only to protect our families, other sex workers, locations of our work, and areas of where service provision that was criminalising our work was taking place. So we released all of the closed session transcripts for everyone in, basically Territorians, to transparently understand the impact of the draconian licensing laws on our lives. And that was very powerful and really important. So other challenges for us were presented in relation to work health and safety, in relation to contesting around planning, actually. And this is a very important point, because when we're looking at decriminalisation and what that's going to look like, and existing laws in place, what's already in place for all businesses or all other industries may not necessarily be in line with what is required. So for us, the planning restrictions and business regulations in the Northern Territory that were only at the time allowing for 1 worker in the NT to operate from home presented safety constraints and difficulties. And certainly as workers, we advocated to work freely in collectives, to have ability to employ support staff, to work with other workers in residential premises. And as the territory doesn't allow for collectives for any industry to operate in residential areas, the compromise was around safety was to allow for 2 workers to operate with support staff from home. And that is a very important precedent that has been set by the government, listening to sex workers. And certainly that sets a precedent to allow for other industry workers working from home to also expand in the future with changes to the Planning Act for other industries to advocate as well. So our evidence demonstrated to the Economic Scrutiny Committee that planning was additionally integral in facilitating safety at work, and consequently the committee recommended that at least 2 workers be able to operate from residential areas and ratified those changes to the planning scheme through the parliamentary process. I think the lessons learned are really important. Decriminalisation does not ensure that automatically the laws in relation to sex work businesses, planning and sex worker work and other industrial protections will automatically enable best practice regulations. And I think I'd like to note that sex workers in the NT have fought hard to ensure work health and safety remained at the forefront of NT reforms and continues to remain at the forefront of the reforms. The regulations and industrial protections are for all workers, amended over time, and the changes to the NT planning scheme and or home occupation provision to allow sex workers insertion, sex work as an insertion is a progressive shift in establishing the intention of the Sex Industry Act for reforms. I think the continual shift by governments in partnership with workers and peak representative bodies as associations and unions ensures all legislation and industrial protections align with human rights. This is of the utmost importance. All industrial reforms must be led by workers with our chosen peer representatives, as it is workers who understand the direct impact of dangerous policies or laws upon our workforces. In the NT, the current collaborative development of work health and safety guidelines with unions NT WorkSafe, Public and Environmental Health Directorate with sex workers and our organisations and national association, the Scarlet Alliance, emphasises the importance of a partnership approach to reforms where workers are enabled to lead in all aspects of our regulatory lives. The NT government has allowed for the voices of sex workers to be visible and heard in all aspects of law reform. The challenge for governments and allied stakeholders, I think, who work with us is to ensure a rights-based approach to these reforms is intersected and implemented without discrimination or assumptions that will continue to stigmatise our work. And I'm sorry, this is a little bit of a long response, but it's a very important response to some of the challenges that we came up against. Thanks.
Thanks very much for that, Leanne. Unfortunately, Kat is experiencing technical difficulties. I'm not sure that we're actually able to hear your voice, Kat. We've got you on the screen. Can you unmute?
Yeah, I can actually. Can you hear me?
Yay!
Hi.
Fantastic. Hi. It'd be really great to hear from you because, as we know, South Australia's attempt at decriminalisation was so hard fought and long fought, and at the same time, it didn't secure the numbers in the lower house of Parliament. With reform efforts that are in Victoria currently underway, what are some of the lessons that can be learnt from the law reform campaign in South Australia?
Yeah, hi everyone, and look, thank you so much for having me. I'm sorry that my video doesn't seem to be working very well. It was quite distracting, so I think it's better to have it off. I'd like to acknowledge as well that I'm on Kaurna land and acknowledge the traditional custodians of the land and their spiritual connection to it. I stand in solidarity with them. So in regard to the campaign in South Australia, it was our 13th attempt at law reform. in this state. We are currently heading into our 14th attempt, which I think says a lot about South Australian sex workers and our resilience and our determination. We've been attempting to reform the punitive and archaic laws that exist in our state for over 30 years now. It's a long, long time, and it's been a long, long fight. Last year we were quietly confident and then absolutely devastated when the bill failed in the lower house. But during the campaign, some of the lessons that we learned, and I'll just let you all know that it was my first real hard fought and campaign that I really got my teeth into out of the 13 that we've had. So some of the lessons were to really stand firm, to really maintain your vision that decriminalisation of the sex industry is 100% the best framework, to not bend to amendments, unworkable amendments that are often born out of misinformation or alarmist rhetoric, or pressure from constituents, for example. So to be really clear and to be really concise about your messaging, about why decrim is the best framework and about why the amendments that might be put forward are unworkable. You know, you need to really bang on about the scaffolding that already exists within industrial legislation and council bylaws that might, you know, already exist in your state or territory, which undoubtedly they do. So monitor the debate, monitor the messaging that's, you know, within Parliament House. It's also within media, so on the outside. Try and be prepared with you know, responses to myths and questions and even outright lies that may be circulated, because unfortunately that happens. Use peers. We learnt that really, really early on, and I don't mean me, I mean 30 years ago we learnt that. Use peers, always. Our voices are the voices that need to be central to any campaign for law reform. Politicians do seem to respond, we found, quite well to sex worker voices as well. So personal stories, lived experiences always seem to have a really good impact. Timing. So timing was important for us. Unfortunately, in Adelaide, we found ourselves in this unenviable position where there were 3 bills presented at once, and they were all reliant upon a conscience vote. So when you're dealing with, you know, conservative politicians or even conservative-leaning politicians, many of them really don't want to be seen as lefties or softies by voting in favour of these 3 contentious bills that were on the table that required a conscience vote. So unfortunately, you know, sometimes I wonder if the sex industry bill was a scapegoat in that situation and got voted down, you know, in lieu of these other 2 legislative reforms that were on the table. So just out of interest for everyone, they were around voluntary euthanasia and abortion law reform. But probably the most important lesson that we learned in South Australia was to never give up, to just keep going, to just remember that, you know, in a landscape that, you know, has consistently silenced and erased the sex industry, that we just need to continue to raise our voices, that we need to continue to ensure that that, as I said before, sex workers are central to the debate, and that our voices are heard, to ensure that sex workers are driving the Decrim campaign bus, and to just keep trying, to keep going. And we will. 14, 15, although hopefully there won't be a 15. 14 is going to be the one. We're ever hopeful and ever optimistic. Thanks.
Thanks for that, Kat. Cameron, now New South Wales was the first place actually to decriminalise sex work in the world. And we know that the councils regulate the sex industry to different degrees in different states. what are some of the issues that you've encountered with the role that councils play regulating the sex industry in New South Wales, and how that's kind of impacted on implementation of decriminalisation?
Okay, well, with local councils, unfortunately, it's been a long fight to prevent them from recriminalising sex work in a de facto way. Narrow sectional interests have great influence on councillors, and for a long time that's meant that things like placing sex work establishments in industrial zones has been the norm, which isn't very safe for sex workers and not particularly good for business as well. And it's led to all sorts of forms of discrimination being brought in to prevent sex workers from working in local council areas. And it's something that really should have been addressed by the government at the time. There was a very good feeling that, you know, we just decriminalise sex work and it'll be a level playing field and everything will go fine. But it didn't. And we've recently reformed the planning laws in New South Wales with regard to a number of what are called sensitive uses. And one of those is sex work premises. And now, instead of sex work premises being the location of being decided by local councils, and that's the elected part of local councils, because nearly every planning decision would be recommended by the actual bureaucratic part of council because it was a legal application, and then knocked back by council. So now those planning decisions go to what are called local planning panels, which are individuals who are appointed and hopefully not, and so far not, influenced by any sectional interests, because they're now insulated from that sort of pressure.
Thanks for that, Cameron. Dylan, we know in Victoria sex workers effectively sorry, and I know this also came up in the one of the chat questions, and that was around the impact of COVID. How has COVID impacted sex workers in Victoria?
Sure, thanks, Jules. So I think this is probably something we could have had a whole panel discussion on. So I'll try my best to keep it really brief. Yeah, COVID-19 has had a really profound and unprecedented impact on sex workers across Australia, you know, as it has on many people's lives or everybody's lives, but the impacts for sex workers and for sex workers in Victoria have been exacerbated by, in Victoria, the licensing system and the kinds of stigma and discrimination that sex workers face. I mean, some of the impacts that that we've seen in the Victorian sex work community, and I will say that I feel that these are getting worse as we now head into the second period of lockdown. So many sex workers, the vast majority of sex workers probably haven't been able to work. There have been periods of time where it's been possible for people to work. But most people have lost sex work income, and many people have also lost income relating to perhaps other casual work that isn't involving sex work. And we're seeing housing insecurity, food insecurity at a quite profound level, difficulty accessing benefits. Many sex workers have been unable to access or simply not eligible for government support, including JobSeeker and JobKeeper. Something we're seeing in the community now is increased policing of sex workers in relation to COVID-19. And that's really, really concerning. And I think it's contributing as well to sort of, you know, a really unfortunate messaging that is really stigmatizing of sex workers and really not reflective of what's been a really, really proactive response from sex workers in Victoria and across Australia to the pandemic. You know, sex workers reacted really swiftly, you know, adapting work practices or shifting away from in-person work altogether well before restrictions were in place. And so it's really concerning to see some of the messaging that's been happening around that. Yeah, then look, there's a lot that I could say about this. It's definitely a really, really concerning time, and I think it makes it really, really clear just how badly we need decriminalisation, because the licensing system has really, just exacerbated many of these harms. Additionally, I know this is going to be covered in another question, so I won't say much about it, but the lack of a funded peer service for sex workers in Victoria has also been a major problem in terms of being able to provide, adequate levels of support to the community.
Thanks, Dylan. Cam, I'm just going to quickly throw back to you. How does HIV criminalisation impact sex work? Because that's still an aspect that's an issue in Victoria. Can you tell us what you believe should be done about this, especially now that we know that a sustained undetectable viral load means that someone cannot sexually transmit HIV?
The same thing should be done about it as should have been done from day one. It shouldn't be a criminal matter at all. There's no reason for it to be. We've had condoms almost since day one. We have not had any number of cases of transmission in the sex industry, so low that they're not statistically recorded. And the ill effects of criminalising sex workers and sex workers with HIV are, well, how long do you have? I could talk for 5 or 6 hours. I'm a sex worker who's lived with HIV and sex work since it was called GRID. And I have a lot of experience in discrimination, barriers to engagement, attempts at blackmail, all the vulnerabilities that come with criminalisation. And we've had sex workers in Australia incarcerated with no evidence, or one case, no evidence that they'd actually even had sex with anybody. But it was just the fact that they were HIV positive, well, 2 cases that I can think of, HIV positive and a sex worker was enough to place them in jail. And also outing as a sex worker, which people may not think is so important, but if you're outed as an HIV positive sex worker, your life in any community is basically over. The stigma and discrimination is incredible. So laws back up stigma and discrimination. They make it a systemic thing. And so the answer to that is decriminalise HIV positive sex workers and make me legal when I go to Victoria. Or make me decriminalise, thank you, when I go to Victoria.
Thanks, Cam. Leanne, after decriminalisation and work health and safety protections have been implemented, are there other areas that you believe are integral to providing rights and safety for sex workers and other sex work industry workers that SWOP NT will pursue in the Northern Territory?
Yes, look, we've learnt that decriminalisation of sex work and the intersection of regulatory frameworks is that are, intended to protect us are not enough to protect all sex industry workers. In 2017, the Northern Territory government asked for Territorians and stakeholders to provide recommendations to modernise the Anti-Discrimination Act. And that included, importantly, a section on whether protections for vilification should also be ratified. Overwhelmingly, the responses from stakeholders were very inclusive of marginalised communities and a lot of recommendations for additional attributes to be intersected in, amended into the Act and passed. And for sex workers with SWOP, with NTUC, the Northern Territory AIDS and Hepatitis Council, and Scarlet Alliance, just to name a few, we were recommending that sex work and sex worker also be put in as attributes under that Act, and that vilification should not be allowed against any communities, including sex workers. Anybody who works with sex workers has an association with sex workers or is assumed to be a sex worker. And that shows you, I suppose that demonstrates how how systemic the stigma and discrimination is against sex workers, and why it's such an important area not to be left out of reforms. I think notably Victoria has in place, legislated some time ago, protections for human rights with a charter. And I know that Vixen Collective very early on gave quite a lot of evidence to support the establishment of those rights, and certainly was inclusive of sex workers' voices. And in the NT, we'll certainly be endeavouring to achieve a Bill of Human Rights as well. And we're not the only sector that really is demanding that and needing that and requiring it. It's we also would like to see, alongside a Bill of Rights or a Charter of Rights, depending on what's going to work for the territory, we'd like to see the appointment of an Equal Opportunity Commissioner as well. And there's also some areas that haven't been included in the Sex Industry Act that we wanted, and that was around making sure that the expungement of spent convictions had been addressed, and it hasn't as yet either.
Thanks, Leanne. And Dylan, I know you threatened to answer this on the panel, so I will ask you very quickly.
I will.
In Victoria, sex workers are effectively forced to undergo sexual health testing every 3 months.
Yeah.
Why is mandatory testing so harmful for sex workers?
Sure. So I think the short things, you want a short answer? I think the answer is it doesn't have any discernible benefits. It's really expensive, and it's really harmful for sex workers. It's harmful for sex workers because, as I said in my presentation, it reinforces this vectors of disease stereotype. It baselessly frames sex workers as a risk to the wider public and actually a risk to ourselves, which fuels sex work stigma that's used to justify other discriminatory practices. And it can also impact us in other ways. It can be weaponized by abusive partners, family members. It can, as I mentioned, negatively shape, doctors' attitudes, and impact care outcomes in a negative way. I think it's not an evidence-based approach. The evidence doesn't support mandatory testing, and in fact, I think it's in the 8th National HIV Strategy that it's identified as actually a barrier, a key barrier to actually evidence-based prevention and access to testing and healthcare services. So it's just unnecessary, invasive, harmful, and again, really expensive for the state for no good reason.
Thanks, Dylan. Janelle, just finally, how important are outreach and peer worker services for sex workers? And can you tell us what are the benefits that you've seen from such services? You're on mute.
You're on mute, Janelle.
Here I go again. So for people who aren't really familiar with the terms, peer education is that two-way exchange of information, strategies and skills that happen between sex workers, right? And so it can happen on an ad hoc or in the workplace kind of basis, but it also happens between the peer ed staff, right, of funded sex worker peer organisations. But it is that intrinsic, sharing of information and skills and knowing what you're talking about when you're providing that exchange and interaction that's really critical. And it's what's worked in Australia, right? It's a principle that we espouse widely as being very successful. But I think when you start to think about decriminalisation and law reform, that becomes even more critical, where it's where decriminalisation and in fact any law change or policy change that's been effective, where that's worked best is when you have a well-funded peer sex worker organisation to implement and to get that information out amongst the community and to make sure sex workers are engaged with the change of policy and the change of laws. And that's exactly the same, right, for decriminalisation. Where it's worked best is when the sex worker organisation is a peer sex worker org funded to support, the development of workplace health and safety guidelines, to make sure sex workers understand the change in the laws. And we're seeing that right now with COVID, right, with the restrictions and, you know, ever-changing landscape that sex workers are working in right now, without that interaction, engagement, then we wouldn't have had the kind of response we've been able to achieve in Australia. And it will be the same for Victoria, right? When it gets to a stage where you know, let's hope the process works and decrim is recommended, and it's a real model of full decriminalisation, not a, a kind of a version that actually creates more barriers and limits. So let's say it's a full decrim model, then what you're going to need is organisations like Vixen to be funded and able to support the sex work community to roll out what it means, all those changes that will need to happen in order for people to be working within decrim. But I guess I'll just end by saying, you know, a big part of that is we talk about this thing called the policy feedback loop, and that is that as sex workers, we're all sharing information all the time about police interactions, problems we're having in the workplace, the way the laws are impacting on us. And we feed that up into our peer organisations, and that informs our policy decisions and informs, you know, the advocacy we do. And that's when organisations are successful, is when at every level there's sex workers and we're able to take that information, our lived experiences of sex workers, and we're able to use that to form our advocacy positions and, you know, our advocacy with politicians. And that is what we're doing with decrim, okay? Because if you, you know, it's not something we've just made up. This is many, many years of sex workers experiencing different models of regulation and feeding into sex worker organisations all the ways that this actually prevents us implementing our safety strategies. And that's why you're hearing so strongly from sex workers in Victoria that it's full decriminalisation that's needed, not just some tinkering around the edges of, you know, licensing or some minor changes. It's actually full decriminalisation that's needed. Thanks.
Great wrap up. So we're over time. I just want to thank again our fantastic panellists. I want to thank again Thorne Harbour Health for putting this on and organising this event. So thank you so much for this important event. And I want to also thank the participants, the attendees for coming in. Sorry if we didn't get to your question. This will also be available as a webinar, but please feel free to reach out to all of us and our organisations if you have any questions. Thank you so much, and let's all hope for a fully decriminalised sex industry in Victoria. Thanks.